Hi, I'm Steve Main with Fitness for Five and the co-founder of Fitness for 10. We're here again with Dr. Melvin Nario of Biointegrative Health Center there in Reno. Great place. If you have health questions, check it out, look them up online. So, hello, Dr. Nario.
Hi, Steve. How are you?
I'm good. So, today we're going to talk about omegas. So what are they, omegas?
All right. Well, omegas, Steve, are pretty common in relation to supplementation. And we always hear about omega in general, but we have to define what omega is first. Omega 3, omega 6. So these are fatty acids or fat-based, I guess, energy sources in our system. And they're called essential, meaning we need them to be given to us from outside sources, or they cannot be created by the body. That's why it's called essential fatty acids. And they are used for normal metabolism and also biological processes in our system. And the most common ones that you would hear would be omega 3 and omega 6. I just want to use those terms because that's the most common thing that we will always hear outside. But omega 3 is also called alpha linoleic acid, and omega 6 is called linoleic acid.
Hmm.
But let's use omega 3 and omega 6 to make it an easier discussion. So, omega 3, there are two types of omega 3s. One is a short chain omega 3, and this can be found in flaxseed, canola oil, and other plant based food sources. And the second one is the longer chain omega 3s. This can be found in mostly fish, shellfish, and krill. And this is the one that we always get from our supplements from the market. But you also have the plant-based ones, but majority of them are more so the fish-based. And the omega-6, there's also a short chain, which you can get from corn oil, sunflower, soybean oil, and even canola oil. Longer chain of the omega-6 found in liver, egg yolks, animal meats, and seafood.
Okay, so I'm assuming that these are important. So why are they important? What's the significance?
Well, the significance of omega, Steve, would be in relation to the nutritional need on how it's being delivered to us. Well, right now, the best example would be the Western diet, the diet that we always eat, almost everybody eats every day, which is rich more in omega 6. This is the fast food sources that we get, the processed meats, and has been known that the Western diet is actually 10 times more compared to omega 3. So omega 6 is more prominent in our Western diet. And humans actually lack the ability to convert this omega 6 into omega 3s, which are the healthier types of omegas. And omega 6 is something that everybody should know is inflammatory and something that would also promote clotting in your system. That's why a higher level of omega 6 would increase your chances on having a heart condition or a cardiovascular disease. That's why the recommendation most of the time that you would hear from your doctors would be you should be consuming less of omega 6 and more of omega 3s for good health. And that's why I want to emphasize that not all omega 6 is bad for the reason that we need a balance of both. But the prominence of that balance should be more on the omega 3s.
So what are the health benefits of omega 3s?
Omega 3s, so many, Steve. This another, I guess, discussion that we can talk about in the future is, of course, heavy metals when we talk about omegas, because that's a very long and, I guess, controversial discussion about the sources of your omegas. And it's all in relation to big fish, little fish. They said that if you eat the smaller ones, has less heavy metals. You eat Nemo, you eat the jaw size type of fish. That's really a lot of subjects to talk about. But the benefits in general of omega 3s would be lowering down cardiovascular risks, lowering down triglycerides, increasing the efficacy of your good cholesterol to fight the bad cholesterol. It lowers down inflammation. And you would hear about the term CRP or HSCRP. That's an inflammation reflecting your coronary or cardiovascular system. It also controls the rhythm of the heart, and it also reduces the incidence of sudden death. I mean, that's pretty general, but of course you don't want to be in the subject of discussion when you talk about sudden death. It also lowers down the heart disease, morbidity and mortality, and also helps with sugar regulation.
Hmm. So are there cardiovascular benefits? I mean, how does it affect cardiovascular disease? I mean, both of them, how do they affect that?
Well, in general, omega-3s has a big role in preventing cardiovascular issues. The thing here is these are the facts that people don't know about, that majority of people who has a cardiovascular condition actually does not have a high cholesterol. And another one would be people are always looking at the LDL or the bad cholesterol. Mind you, that majority of people who are sick with a cardiovascular condition actually has a low bad cholesterol level. And again, another one is the statin clause, the statin that we always hear about that lowers down cholesterol. And more of patients who are on statins, who has cardiovascular conditions, actually has more comorbidities or complications than those who are not taking cholesterol medications. Again, so much topics to talk about, but the premise here is these conditions that I mentioned, omegas plays a big role in turning them around.
Hmm, that's very interesting. So are there any potential side effects with omegas, omega-3s?
Yeah, that's a good question, Steve. We're thinking everything about omegas are pretty safe. We can take it anytime. Thing here, what I caution people about is when you have a heart rhythm problem, and you would hear the word atrial fibrillation, and which is prone for patients to make clots and blast into what we call pulmonary embolism. Having this basic rhythm problem in your heart can be aggravated sometimes by omegas. And also when you're bleeding, for example, somebody who's taking anticoagulants or Coumadin, as we call it, this can aggravate the bleeding condition of that specific patient. It can prolong and make them bleed longer. And also, when you hear about the quality of fish oils or omegas, when somebody takes a rancid type or a bad type, they can get bloated or gassy. So that now depends on the quality of the omegas that you choose. So again, as I mentioned, omegas, you can definitely safely use that. But when you talk about cardiovascular condition, somebody is really sick, definitely professional help is needed to guide you through that.
Okay, so you said there's multiple types of omega-3s and 6s, right? Short and long chain. Is there
Mhm.
any others? Is there like a omega-2 or anything else?
Well, there are. I mean, when you talk about the chains, long chain, short chains, you would hear about polyunsaturated fatty acids. There are so many things out there that, again, a good example would be your olive oil, the one that's a big part of the Mediterranean diet. That's another type of fatty acid right there. But there's so many things out there that, yeah, we can talk about, but right now, these are the ones that are put to my attention, especially with the patients that I see right now. And they need a little light in understanding this. But you're right, there are so many things out there.
Okay, so last question. What's the recommended dose? How much do we take? How do we get it? What do we do?
Well, Steve, the thing here is this is something that I would probably not give you a specific answer to, for the reason that in the market you would see like the regular supplement you would buy over the counter. It's 900 EPA, 600 DHA. This is the two components of the omega threes. and this is what you always see in a bottle. The thing here is, if you're probably healthy, you can take it, but we or me, as I see patients or anybody who's treating cardiovascular conditions such as somebody who had a stroke or heart attack, we go for at least high as 4 grams a day, meaning this is a lot of omegas that we're talking about to negate all of these bad effects that I just told you about. But ideally, the answer for that would be it's individualized. And how do we individualize doses? We require blood tests. And this is where we look at the omega-3 index, the levels of EPA and DHA to give a patient a specific recommendation. But in general, if you're healthy, yes, the over-the-counter 900 over 600 milligrams is fine. But when you talk about complications, we definitely need to talk about various doses for you.
Okay, so actually I have one more question. So, a lot of these supplements, these are expensive, these omega-3s. Can you just take a spoonful of olive oil or sesame seed oil or?
Yeah, well, I mean, there's truth behind that. So when you mentioned about olive oil, you mentioned about sesame oil, you mentioned mostly the plant-based sources of omega-3s. When I
Gotcha.
mentioned about fish oil or krill oil, these are fish-based. The consensus here is the powerful effect has been found more in the fish-based. And that's why the vegans are having a problem with this because they need to take more of the plant-based sources to get to that effect of the fish-based omegas. And the thing here is, again, as I mentioned to you about heavy metals possibly in fish that would limit your intake. Again, that's a whole new discussion. But right now, the processing of omegas has been known to be cleaner than before. That's why when you go to a reputable company and you buy omegas there, most of the time it's pretty clean. But again, going back to your question, nothing so far has been proven to beat the power of fish oil omegas if you want to compare it to plant-based omegas.
Interesting. Well, I'm glad I asked that. Okay, so that's Dr. Nario at Biointegrative Health Center in Reno, Nevada. Look him up if you have questions. Thanks for being with us again, Doctor.
Thank you, Steve. It's a pleasure.
Okay, we'll see you next time.